All right, let's talk about the compliance before procedures. Before any major procedure here, we need to do informed consents. Usually the informed consents are stored in this part of the, in that area of the surgery. It can vary in the future, but today it's over there. So you need every clinician before root canal procedure, before crowns and bridges, implants, surgeries. We need to do. We need to explain the patient the risks, and we need to collect their signatures for that. Okay. In the future, we may change, but today's what we're doing. I have plans already to change the informed consent, but this is what we have today. If you see it's if it's a different form, fine. But what is important, we always need to do dental assistance. Please help the dentist. Sometimes I make the mistake. Sometimes I do crowns and I don't because it's something so normal for me that I forget to do the informed consents. But please don't do that. Okay. For restorative treatments, yeah, just a moment. I'll be there. For restorative treatments, simple fillings, we usually ask the reception to do the informed consent, and then we you don't need to go ahead and talk a lot about this. But always that we have a restoration that is too deep, take photos. I usually take multiple photos when I'm doing a filling, for instance. I take a photo before with the decay, during the preparation, sometimes with the part of the preparation when I open the access and there is the case tube there, and then once I clean, and then after the filling is done. And with this, I can explain to I briefly explain to the patient, oh, this is the case deep, and you may have postoperative sensitivity or even need for root canal. Okay, this is what I do in general. Extraction and implants. Okay, let me just show you. This is what we've been using today. It may vary, it may change in the future, it's normal. We always do before any surgery, we do a checklist of the patient. You may ask, oh, okay, but why we have another one that is the normal medical history, which is done by core practice. Yes, it is. But what I found is it's easier for us. It's a review that we can check all possible problems that we could have in the surgery. I've canceled a few surgeries because of this. You know, I start asking questions and the patient says, oh yeah, my blood pressure is a bit high, but don't worry, it's exactly what has happened a few times. And then I go and I measure the blood pressure, it's almost 200, and then we need to cancel. So when we do surgeries, we need to do this, and we have the informed consent for surgery as well. Okay, and then we can explain the relation with the nerve, bleeding, swelling, blah blah blah, and everything is here. Okay, my plans is to change all of this to have one informed consent, and we tick the boxes that are more important for that specific case. But this is what we're going to do in the future. Okay, it's the same thing for implants. The implants, we do this informed consent and another informed consent just for the implants. Okay. If you need to do a crown, bridge, or veneer, crown bridge is this informed consent here. Veneer as well. We also have informed consents for splints, for periodontal treatment, and other treatments as well. Okay. This is just a quick video to explain the importance of the informed consent, and you need to explain, and the patient need to be aware of the risks before doing the procedure. Okay, thank you.